Hi, I'm Dr. Sharanya, consultant obstetrics and gynecologist and laparoscopic surgeon at Teja Hospitals, Ambattur. So let's talk about cervical cancer today. What is cervical cancer? Cervix is nothing but the mouth of the uterus, and cervical cancer is the second most common cancer in women after breast cancer. So what's special about cervical cancer and why do we need to talk about it? It is one of the only cancers that can be completely prevented. So how is that possible? இப்போ யூசுவலாக பார்த்தீங்கன்னா cancer cause is because of genetics or your lifestyle or any environmental factors. But there are multiple studies that have proven that cervical cancer is caused exclusively by a viral infection called the human papilloma virus. So இப்போ இந்த HPV virus அப்படிங்கிறது it will cause the cervical infection, and the cancer causing strains are 16 and 18. These cancer causing strains will cause sexually transmitted cervical infections, which in certain cases can persistently be there and go on to cause cancer after 10 to 15 years in certain women. So இதை எப்படி தடுக்கலாம் அப்படினு பாத்தீங்கன்னா there is a simple method, and that is the vaccination against the HPV or the human papilloma virus, and this will prevent the HPV infections and its progress to cervical cancers. So apart from cervical cancers, the HPV infections can cause other cancers such as anal cancers, penile cancers, oral cancers, and also genital warts. இப்போ இதெல்லாத்தையுமே வந்து இந்த HPV vaccine-நால all these cancers can be prevented. So who needs to be vaccinated? So according to the Indian Academy of Pediatrics, there is recommendation for all female children to be vaccinated from the age of 9 years to 15 years. So இப்போ இந்த vaccination miss பண்ண எல்லா other women என்ன பண்ணனும்னா, there are many studies that have been proven now that up to 45 years of age we can do something called a catch-up vaccination, where women who have previously not been vaccinated against cervical cancer, who have already had children, who have already had sexual exposure, can still be vaccinated against cervical cancer with almost 100% efficacy. So what is the schedule of this HPV vaccination? For young children aged 9 to 15 years, we have to give 2 doses 2 months apart, and for all the other women who are having the catch-up vaccination, we have to give it as 3 doses in the schedule of 0, 2 and 6 months. So moving on to the most important question. Madam, what are the side effects of HPV vaccination? So fortunately, HPV vaccine is a completely safe vaccine with very minimal to almost nil side effects, which may include side effects such as injection site pain or redness or very minimal feverish feeling. So who can and who cannot take this vaccination? So during your menstrual cycle, it can be taken during any part of your menstrual cycle in the month, and only people who need to avoid this vaccination are pregnant women. And the other thing is, even breastfeeding or lactating women can take this vaccination. So what is the efficacy? There are multiple studies that have proven that the vaccine is almost 90 to 100% effective in preventing cancers of the cervix, anus and the penile cancers. So there are studies that even male children in other countries, இப்போ வெளிநாட்டுல பாத்தீங்கன்னா, even for male children they are recommending the HPV vaccines from age 9 to 15. Even in India, I think recently now we are also included boys into the vaccination schedule for prevention of these cancers. Okay, so there are actually 3 types of HPV vaccines: the bivalent, the quadrivalent and the nonavalent vaccines. The quadrivalent and the nonavalent vaccines, which are preventive against 4 and 9 types of virus strains respectively, are almost 100% effective in preventing cervical cancers. Previously, the awareness for HPV vaccination was not so effective or rampant, but now as we have a lot of awareness and the safety and efficacy of the vaccines have been completely proven, so I think now it is a compulsory must that all women in India should be prevented from the effects of cervical cancer, and I urge all of them to take the HPV vaccination.